So, hello and welcome everyone. Thank you for joining us for this next installment of our series on ancient Egyptian cancer, disease, treatment, and evolutionary perspective. Some of you may have been expecting Tatiana Tondini, who was originally scheduled to present this lecture. Unfortunately, due to last-minute circumstances, we have had to change in the programming. But I'm very excited to introduce Dr. Edgard Camarós, who was the corresponding author of the article this presentation is based on and supervised the entire project. So we will be hearing a specialist on the topic still, and the same presentation will be presented. So just a little bit more information about our speaker. Edgard Camarós is an assistant professor of prehistoric archaeology at the University of Santiago de Compostela in Spain. Previously, he served since 2022 as a Marie Curie Researcher at the University of Cambridge and is senior member of King's College. His research covers human evolution and palaeopathology, and he is highly interested in the understanding of early surgical practices. He leads the archaeological excavation at El Pendo Cave in Spain, a site listed as World Heritage by UNESCO since 2016. So we are very excited to hear all about your project and your very exciting findings. And just for those watching, as you will see, this talk will contain images of human remains, so please be aware of that as we continue. But all that's left for me to say is thank you very much to Dr. Camarós for stepping in and presenting for us. We're very grateful for your presentation today. Over to you.
Well, thank you very much. I'm absolutely delighted of delivering this talk today. And you might have been expecting Tatiana Tondini. I'm not Tatiana, as Charlotte Jordan has already mentioned. Unfortunately, she's not available because she's in the field. She's in Greece excavating. And I say, unfortunately, it might not be the word because I'm pretty sure she's very happy excavating. And I'm also very happy presenting this talk today on ancient Egyptian cancer to talk about the disease, the potential treatment relating with this amazing period, and briefly about the evolutionary perspective. And what we're going to do here today is we're going to talk about cancer, which is something that Tatiana and I are very, very interested in, but from the point of view of paleopathology. And that means that we are interested in going back in time and try to understand how this disease has evolved. And we're doing that by using specifically paleopathology, as I mentioned. And before I continue and go speaking about cancer, I have to say that obviously in this image, they're going to be human remains. And given the nature of the talk, some of those remains will display cancer. So it might be a bit shocking. It's just to let you know what we're going to see, but we're going to treat these. We're going to treat this subject with the utmost respect and the highest ethical standards. And before I continue, that cancer, you probably know that cancer is as old as multicellular life. So it's not just something related with modern life, as we usually tend. Nowadays, we unfortunately surrounded by cancer. Hopefully, cancer research is changing the life of those patients and the families suffering from that disease. But because of that, because we have a lot of patients and a lot of cancer cases nowadays, we tend to think that cancer is a modern disease. And it's not. You can see here in this image that, for example, dinosaurs also suffered with cancer. We have fossil shells. We have many animals that display this disease. So it's a very, very old disease that has changed through time. And something interesting about cancer is that cancer is influenced by geography, by chronology, and also obviously by the way we live, as we know nowadays. And even our ancestors have also suffered cancer. The oldest evidence of cancer in our human lineage, you can find it in those two fossils from Homo ergastes of Paranthropus, hominins from South Africa, from the cave of Schwarzkranz or from Malapa, dating more than 1 million years ago. And you can see that this is the evidence that this is a fifth metatarsal, so it's a finger. Sorry, it's a toe, a toe. It's a toe, and it's displaying the evidence of a cancer. And here you can see also in this vertebra the evidence of a tumor. And this has been discovered by using palaeopathology. And if you let me stop sharing a bit, I'd like to show you the very latest case that we are studying in my lab. And you can see here a human skull dating from the Roman period. It has nothing to do with Egypt, but this is just to show you that we deal with real human bones. And the aim of what we do is to reconstruct the life of these people by using biological anthropology and also paleopathology to try and see what diseases these people suffered, contextualize those diseases in the period these people live, and try to open a window to the past by using human remains. And this is an example of this Roman individual that here displays a lesion that we think it might be a tumor. So tumors are all around, but finding them from the point of view of paleopathology, it's quite difficult. It's not an easy task. And we will see that most of the cancer lesions, most of the cancer evidences in the archaeological record, we find them in very recent times. And this is not just only because they preserve very, very well in modern archaeological contexts, but it's also because it's all cancer. The prevalence of cancer, it seems that it is higher, obviously, nowadays. But it's a matter also of recognition of that disease, which is not an easy task. But when it comes to cancer treatment, when it comes to surgeries linked to that cancer, things get really, really difficult because actually medical response to cancer, it's a very, very recent thing. This is an image, for example, of Professor Stuart Halstead, who was the person that stated that mastectomy was the best way of dealing with breast cancer. And this is in very recent times. So even the surgical intervention of cancers is something very recent. But the archaeological record, the osteoarchaeological evidence, shows exceptions because cancer has been treated, for example, since the 18th century. Mastectomies were practiced in the 18th century. Even medical instruments were designed and performed in order to conduct specific surgical interventions like mastectomy. And this we are talking about the 18th century. But if we talk about the 16th century, this even was already practiced. And we're talking only about mastectomy. But cancer evidence, if we go back in time, we just have a bunch of cases. This is, for example, the period from the Old to the New Kingdom in Egypt, according to Ian Shaw, running from 2600 to around 1000 BC. And as you can see here, the numbers of bones that evidence neoplasias or cancer evidence are just a few. Some of them, even one of them, you can even see it in the British Museum, which, if I don't remember badly, it's a rib with the evidence of metastasis. So there are not many cases, but among those few cases, many of them come from ancient Egypt. And why is that? Well, that is because Sir Armand Roffa, a physician that moved to Egypt in the late 19th century and first decades of the 20th century, he was very, very interested in paleopathology. Actually, he's the father of paleopathology. And it's interesting, it might be interesting for you to know that paleopathology was born under the shadow of Egyptology. And that is because we've got amazing evidences in ancient Egyptian context. This is an example of one of the cases that Sir Armand Roffer studied, and they come from the book Studies in the Paleopathology of Egypt. This is an amazing book published in 1927. I have here a modern version of it, but it's an absolute delight to read this book, where you can see that paleopathology evolved from Egyptology. Sir Armand Roffer even designed a method to rehydrate the soft tissues of the mummies. He was a physician, so actually it was also very easy to study human remains, mummified human remains, and provide a regressive diagnosis. And actually, if you look at paleopathology and all those words that are related to it in the bibliography, you will see that mummy is one of the biggest ones. So meaning that paleopathology is intimately related with Egyptology and the study also of mummies. But we're not going to talk here today about mummies. We're going to talk about a different biological, anthropological reality, and that let us link those human remains to the development of medicine in ancient Egypt. And as you probably know, the development of ancient Egyptian medicine was absolutely amazing. We have evidence in the papyrus. For example, the Edwin Smith papyrus, dating almost 3,000 years ago, where we think, being very positive, we think that they talk about a breast cancer. And this interesting thing is that they might have recognized what we nowadays call tumors, what we nowadays call cancer. Obviously, cancer, it's a modern concept, but they might have recognized something different. And cancer, there are many diseases also, but they might have recognize what we nowadays call cancer. And the very interesting thing is that they said there was no treatment for it. They said that almost 3,000 years ago. But then the Ebers papyrus, around 1,500 BC, we can see that they really know how to recognize things that we nowadays call soft tissue tumors, potential skin cancers, uterus cancers, stomach cancers, cancers of the rectus, and they intend to provide some kind of treatment, at least treatments related of the palliative effects of that, like for example covering the tumor with fresh meat, and that it's probably related with the homeostasis. So they some kind recognize that, and they recognized that there was no treatment for it. Obviously, treatment for cancer is in the 8th century. Very developed tools like the one we can see here, graved on the Temple of Ombo in Egypt, where you can see the depiction of the surgical scalpels, knives, and other tools that some of them might be related with surgical interventions. I have here some of the replicas that I use in my experimentations with corpses at the Faculty of Medicine to try and reconstruct the surgical interventions in the past. And this is important to reckon because it will be very important later for the evidences that we found in some of the skulls that we've studied. But in relation to ancient medicine, we have to say that it's not just that they recognize diseases, they recognize lesions, pathologies, that they do have sometimes very interesting treatments. So it's a very modern medicine based on observation, diagnosis, and treating that disease. sometimes, as we've seen, with some very specialized tools. But the interesting thing about medicine and the modern conception of medicine in ancient Egypt is that they also try to provide a better life to the people suffering from a disease or from a lesion, from a trauma, whatever. And this is an amazing example of it. We've even found an Egyptian a toe prosthesis from a Theban tomb, where you can see that they are providing some kind of prosthesis to restitute the thumb in order to stabilize the walk of this person. So probably they not just surgically intervene and amputed the toe, but also provided a way of improve the life of this person. Same thing happens with the dentistry evidences that we have from ancient Egyptian. They wanted to make life better, improve life, which is a conception of a modern medicine, showing that they were very advanced in relation to this. And it's important to have this in mind, because you can see that they have this exploration, they have this very scientific approach to disease. And this is the context of the research that we've conducted at the University of Cambridge in relation with some of the bones that we found at the Duckworth collection and laboratory, which is one of the largest repositories of biological anthropology. And it was established in 1945. And Tatiana Tondini and I, we were looking for some of the bones there. And inside a box 236, we found these written messages here saying that there was a human remain with a neoplasia. And we were not the first ones of opening that box. It was not like the opening of the tomb of Tutankhamun by Howard Carter expecting treasures that nobody saw, because actually we were not the first ones to study that bones. Dr. Calvin Wells in the 60s of the 20th century, obviously, he already looked at those bones and diagnosed, for example, skull 236 with a neoplasia, specifically with a carcinoma of a nasopharynge. And he was right, as we will see later. And we start studying those bones, that they came from Giza. We don't know exactly where they come from in relation to this archaeological locality, but we know it was quite close to the pyramids, according to some of the notes that we found inside the box. And we guess they came to the University of Cambridge maybe in the first decades of the 20th century. But we don't know exactly. And these are the two skulls that we studied for the paper that we've published, that intended to show the frontiers of the Egyptian medicine, the different boundaries that we can see in this period, because they exemplify very, very well the boundaries that Egyptian medicine had. For instance, we have a skull E270, where you can see that we has a tumor here, but also a traumatic injury. And then the most interesting skull in terms of reconstructing the ancient Egyptian potential treatment, we have skull 263. And we can talk a little bit about them. We can see, for example, here, lesion 1, which is a massive tumor with a mixed lesion. We call it a mixed lesion because it has a osteolytic lesion, that means the destruction of bone, and the osteoblastic lesion, which means the creation of this bone. And you can see the speculations here. In my field, we call it like sunburst type of bony osteoblastic reaction. This is lesion 1. It is a massive one. I mean, we took with us some of the best specialists on oncology to look at that bone. And for them, it was the very first time that they saw this kind of a cancer, so advanced cancer. And that is because they are not used to see wild cancers, because obviously nowadays they treat them. So we can see huge, huge lesions, neoplastic lesions. And then we can see lesion number 2 and number 3, that those are traumatic lesions. So these are things that related probably, that they were produced probably in the context of interpersonal violence. The interesting thing about this skull is that you can see that cancer was never treated. As they said in the papyrus, cancer has no treatment. And this must have been a very, very massive thing, a very, very visible thing. But the previous lesions, the traumatic lesions, though those were treated, the potential infection was treated, and probably some kind of neuro surgery was applied, because this is a very serious lesion that if you don't work on that, yeah, this person might have been dead. And no, this person survived this traumatic lesion, and then sadly probably died from that tumor that has on the upper part of the skull. So we're clearly in front of a boundary of that knowledge in ancient Egyptian medicine. They know successfully how to treat, probably surgically, traumatic lesions, but not cancer. That is what the very clear evidence of how advanced it was the ancient Egyptian medicine. But when it comes to cancer, there is a clear boundary. A boundary that it's in negotiation when it comes to the study of this skull. Skull 263, belonging to the 3rd, 5th dynasty, so that's in the Old Kingdom, which is a male around 30-35 years, displays a primary tumor. You can see here the destruction of the palate bone, and this is probably the nasopharyngeal cancer that Dr. Calvin Wells diagnosed in the 50s. We did a micro CT study, and we also agree that might be the diagnosis. But also a very interesting thing is that this skull displays secondary tumors, or what is called also metastasis. So it's showing us that the cancer evolved, and it's in a very advanced stage concerning this the development of that disease. So we studied those perforations, those holes that you can see an image here, and we looked at them with the microscope. We looked at the bone surface of that microscope, of that bone lesions related to those secondary tumors. And we studied, for example, that one here on the back of the skull. We studied that one here, and what we found was absolutely amazing, because under the microscope, those metastatic lesions, those secondary tumors, they resemble these lines here. Okay, if somebody knows a little bit about paleopathology or archaeology, will know that these are cut marks. And cut marks need to be characterized. And if you look at them very, very closely with a microscope, you will see that those cut marks, they have a V section, meaning that they were produced with a metal object, and they are intimately related with the tumor. All of them display the same direction, so more or less in this diagonal direction. And when we saw that at the microscope, we were absolutely amazed, because this is the evidence that ancient Egyptians were cutting with something similar like that, with a metal, very, very sharp scalpel, knife, or whatever, a surgical tool. They were cutting on top of those tumors that would have been visible while this person was alive many, many years ago. And that was amazing because it was a clear evidence that they are dealing surgically with this tumor. However, the post-mortem exploration, probably in the context of a mummification. And it's very difficult to answer. What we have to say is that given the morphology and the characteristics of those cut marks, they were made perimortem. And that means in a moment near to the death of the individual. That means that they performed that while the bone was in a fresh state. We've looked at all the other parts of the skull, and we haven't found any evidence that this person was mummified. So, and there is no reason why a mummification would work on those parts of the back parts of the posterior parts of the skull. So what we think we are seeing here is a clear evidence of two possibilities, but both of the possibilities are very interesting in terms of understanding the advancement and the scientific vision of ancient Egyptian medicine. Because option one might be that they are exploring what cancer is during an autopsy, during a post-mortem surgery, exploring, trying to understand what cancer was. But then the other possibility is that they are trying to treat cancer. How? Well, trying to surgically intervene on top of them. In a very similar way, they would work surgically in an infection abscess, for example. And this is very interesting because actually this is the very first evidence of a surgical oncological intervention, showing us that paleopathology has the capacity to open windows to the past, to try and understand aspects that are very difficult to understand by, for example, looking at papyrus. If we start cancer surgically, we might then try and look at that in many other anthropological bones for a better characterization of ancient Egyptian medicine. And this is a bit the abstract of what we've been working on to show aspects of the cancer in the past. But we are very interested in many other cases of many other periods, and that is the evolutionary perspective. Because if we understand cancer in the past, that might help also understand the understanding, might help us in the understanding of cancer in the present and in the future. Because cancer is subjected, it's also under the laws of evolution. Cancer has changed, cancer evolves, and if we're able to see how it deals with our immune system, how it deals with our own species, we might be able, from the past, in helping trying to understand cancer in the future. And of course, ancient Egyptian cancer is also contributing to that, because the next step is trying to characterize from the point of view of the genetics, this kind of cancer, the cancers that these individuals had, to see if they were similar or not to the ones that we suffer, and trying to provide these evolutionary perspectives. So I hope you enjoyed this presentation. Thank you very much.
What a brilliant presentation. Thank you very much for stepping in today, for one, but for telling us all about such an interesting discovery, I suppose. The first evidence of treatment on cancer happened in ancient Egypt. So thank you so much for sharing that with us here at the EES and our audience. We're very grateful for your time.
No,
So
thank you.
yes.
It was a pleasure.
But I just wanted to point out how interesting it was to get a little bit of background about the paleopathology and how it was born out of Egyptology. I never realised that, so that was very interesting to touch upon in your lecture as well. So thank you for that. Great. Well, yeah, I think that all that remains for me to say is a huge thank you to Dr. Edgard Camarós for presenting for us today. Thank you so much. And I'd just like to note that our renewal period for EES membership is open. It's only thanks to the support from our members that we are able to present these lectures for free and disseminate these brilliant discoveries and firsts for Egyptology or paleopathology. The interdisciplinary project. So yes, thank you all for joining us. Please do consider joining us as a member to help us do even more in future. And I did share the link to the paper that appeared in Medicine, Frontiers in Medicine, sorry. So please do go and read that if you want to learn more and download it and cite it and all those brilliant things if you want to learn more about this research. And I don't know, can they get in touch with you, Dr. Camarós?
Absolutely. If anybody has any question, they just write an email and I'll be happy to answer. And let me say that it was a pleasure delivering this talk today here and acknowledge the amazing and wonderful work you're doing from the society. So thank you to you also.
Oh, thank you. So yeah, we will hopefully see you on another event soon. And yeah, thanks for joining us. Bye,
My
everyone.
pleasure.